Trust for Reaching the Unreached, popularly known as Lok Swasthya Mandal, works in 4 talukas: Halol, Jambugoda, Gogamba, and Kalol in the rural tribal district of Panchmahal in Gujarat to provide community-based mental health care. Since the early 70s, community health work has remained strongly focused on maternal and child health and infectious diseases. However, since the new millennium, it has become increasingly clear that we also need to focus on non-communicable diseases such as cardiovascular diseases, diabetes mellitus, chronic obstructive pulmonary diseases, malnutrition, obesity, mental illnesses, and many others.
In general terms, a mental well-being of a community or of a person is defined as a socially and economically productive life as per the norms of his or her community. When a person deviates a lot from there for a long time, it's considered that he or she is having a mental illness.
For a mentally ill person living in a remote area, getting proper treatment is a huge challenge. Unlike physical illness, a patient with severe mental disorder is usually not aware that he or she is suffering from an illness. Not only do they not seek treatment, but in many instances they even resist treatment. So, their treatment depends upon the initiative of family members. Often the community and the family of the patients also have wrong notions regarding the causes of mental illness. They do not accept the problem as a disease, and so they seek solutions from black magic, folk healers, and others.
Mental well-being of people is quite a neglected branch in healthcare system. So we need to focus on some of the basic issues in mental health.
Medical care of the mentally ill patients is not yet fully available even at district levels all over the state. A major reason is non-availability of psychiatrists, clinical psychologists, psychiatric nurses, and other trained staff to take care of mentally ill patients. Also, people still believe that mental illness is due to black magic and often seek treatment from traditional folk healers such as the Badwa, Buva, and others. A few NGOs have tried to develop community-based social interventions in this area, but there is a wide gap between scarcely available psychiatric medical care and almost non-existent community-based social interventions in the mental health sector.
We in TRU have developed certain interventions which have proven effective for treatment and rehabilitations of the mentally ill patients. And TRU works with number of community-based mental health workers who are specifically trained in various aspects of mental health care in a family and in a community setting. Our community mental health workers are members of the same or similar community, and their advantage is that they know the community very well and the community also knows them well. So their acceptability in a community is ensured. They understand and know the traditions, they know the behavior of the people, they know the relatives, and they know the leaders of the area. So they are, when they are specifically trained to work in the field of mental health care, they do a good job.
TRU also organizes health awareness programs in the community to promote the identification of patients. TRU sensitizes the government health cadres such as accredited social health activists or ASHA, Anganwadi workers, auxiliary nurse midwives, multi-purpose health workers, and also the medical officers of primary health centers through personal contacts and through educational materials and training programs. The village leaders like Falia Agavans, the Panchayat members, the dairy members, the shopkeepers, and others also help in identifying the patients. The local school teachers, high school going students, and other youth are also looped in for the identification work. Our community mental health worker visits the home of each patient at least once every month to see that the medicines are taken in the appropriate dosage daily at the prescribed time. They also encourage the patient's caregivers to bring the patient regularly to the clinic and continue their medical treatment without taking a break. Mental health worker visits the patient's home in the week following the doctor's visit to ensure compliance to the medicine schedule and to make general observations. Often, the caretaker is found to be confused about the dosage of the medicines. In such cases, the mental health worker explains how the medicines should be taken correctly. He or she takes extra precautions when dealing with illiterate or elderly caretakers and often suggests innovative ways of remembering the dosage and giving medicines on time.
We have experienced that the patient improves faster if he or she lives with the family in the middle of a community, because it provides familiar and supportive environment, relatives' attentions, and above all, caregivers' direct inputs are given to the ill patient's life. As service provider, TRU's contribution is to identify each gap and impediment for successful treatment of the patient, so that the services really reach the patient in a manner that it is expected to. With the confidence earned from more than a decade's work in this field, we firmly believe that just as in maternal child care and communicable disease issues, the social interventions in the case of mental health will also will prove to be a very pertinent action.